Argamuni kabajamtoota fi jaalatamtoota daawwattoota Oromiyaa11 akkam jirtu naga jirtu isin jecha har'a bakkitti argamnu Walgahii IOHPA irratti argamna. Yeroo ammaa kana IOHPAn Walgahii addaa tokko yaamee jira. Inni kunis dhimma ogeeyyota fayyaa Oromoo irratti carraawwan biyya alaatti argaman keessattuu ogeeyyota biyyatti baratanii gama biyya kanaa erga dhufanii booda waraqaa dhabanii rakkatan kanneen biyya Oromaa keessatti carraan gama barnootaatti deebi'anii yeroo gabaabaadhaan gama barnoota isaaniitti deebi'anii haalli isaan hojiitti bobba'uu danda'an akkasumas bifa wal fakkaatuun ogeeyyota fayyaa Oromoodhaa uumuu irratti resoursiin yookiin qabeenyi biyyi kun namaaf kennitu maal fakkaataa waan jedhu irraa mari'achuudhaaf deeman. Ogeeyyota fayyaatis gamanatti affeeranii warroota qabeenya yookiin risoorsii namaaf kennu dubbisaatiin jira jechuudha. Walgahii isaanii irratti argamneetiin maal fakkaataa uummanni Oromoodhaa gama ogummaa fayyaatiin ogeessa fayyaa baay'ifachuudhaaf maal godhuu qabaa, eessa deemuu qabaa, kan biyyatti baratee dhufe biyya kanatti hoo garam deemeetiin sartifikeetii isaa fudhachuu danda'a. Gama ogummaa isaa duraatti deebi'eetiin immoo hawaasa isaa tajaajiluu danda'a. Akkasumas ogeeyyota haaraa hoo akkamitti uumuu dandeenya waan jedhu mari'achuudhaaf deeman. Nutis asitti argamnee sagantaa kana simbiraan gahuudhaaf deemne jechuudha. Akka xumura sagantaa kanaatti nu wajjin turaan affeerraa keenya.
Akkam nagaa fayyaa Dr. Ibrahim Amee Alamooti Pireezidaantii Waldaa Ogeessota Fayyaa Oromoo idil addunyaati. As guyyaa har'aa magaala lakkuu Minneapolis Minnesota walgahii damee waldaa keenya ka kutaa Minnesota akkasumas konferensii waggaa walakkaa qindeessuuf karoorfannee konferensii kanaaf walgahii kanaaf asitti argamne jirra. Kaayyoon konferensii keenya kan walakkaa waggaa as magaala Minneapolis University of Minnesota Medical Center kanatti kan gaggeeffamaa jiru. Kaayyoon guddaan chaapterii keenya damee waldaa kanaa kan Minnesotaatii fi kan jiddugaleessa biyya keessa jiraatan kan cimsu waan hojjechaa jirru akka gaarii miseensa keenya ibsine jaarmaa kana Minnesota keessatti akka gaarii akka inni chaapteriin kun jajjabaatee hojii caalmaa hojjetu godhuudha. Ka biraa ammallee doktoroota ka Oromoo ka Itoophiyaa dhufan biyya kan keessatti leenjii doktoroota barbaachisu yeroo isaan leenjii kanaaf qophaa'an deeggarsii gahaan akka kennamuuf University Minnesota waliin taane akkasumas MDH dhaabbata eegumsa fayyaa ka isteet kana waliin taane doktorooti kun akka leenjii kan irraa bu'aa argatan wal qunnamsiisu doktoroota kennaaf miseensa kenna kan tahan doktoroota kennaaf warra sagantaa kana qindeessan ka isteeta Minnesota akkasumas ka University of Minnesota keessa sagantaa kan hogganan warra kan walitti finnee doktoroota kenna ka bakka hedduu jiranillee akka isaan yoo as naannoo kanatti gaafa dhufan tajaajila kan irraa akka isaan bu'aa argatan haal mijeessuu fi kaayyoon keenya lamaan guddaan kanuma. Kaan ammoo waan hojjennee bifa kitaabatiin maxxansuuf deemna. Egaa peejii gara 380 waan hagamma barreessaa ture waan hagamma hojjennu walitti qindeessine qabannee jirra. Kanas hin garsiifna. Wanni guddaan egaa ammallee konferensii keenya ka waggaa ka fulbaana keessa deemuuf akkasuma nama keenya dadammaqsuufillee midiir konferensiin kun waan nu gargaaruuf lafa xaraguu fi karaa midhaafachuuf waan kan goone jecha. Yeroo ammaan kana irratti hawaasi Oromoo diaspora keessa jiraatu nuhu wanti nu dhaabbanneef isaan tajaajiluudha. Deeggarsi nu hawaas kan irraa maallaqaan barbaannu hin jiru. Yeroo nu tajaajila isaaniif dhaabbilee tajaajila hawaasa Oromootiif kennan gaafa nu kootta tajaajila kana fudhadha gaafa jennu wanni kun waan isaanii ta'uu beekanii tajaajila dhufanii itti fayyadamu. Keessattuyyuu maanguddoota isteeta kan keessa jiraatan tajaajila gahaa akka isaan argatan tajaajila gahaa akka isaan argatan nu advocate ni goona rakkoo isaanii hin ibsina mootummaalleen gaafa hawaasi keenya akka gurmaa'insa qabu rakkoo ammallee gartee tajaajila fayyaa akka gaarii argachuu kana rakkoon jirtu maan akka ta'e gaafa hubatan gaafa nu gurmaa'insa qabnu resourcin qabeenyi as keessa jiru hawaas keenya fi gaafas kennamuu danda'a. Kanaafiyyuu hawaasi keenya gaafa nu waan akkasii kan qindeessine koota mul'adha gaafa nu jennu dhufanii wal bira dhaabbatanii mul'achuun jiraachuu keenya hin agarsiisa. Kanaafiyyuu dhaabbati kun isaan tajaajiluuf nu dhaabbata kana waldaa kana nu ofiif hin dhaabne hawaasa Oromoo tajaajiluuf dhaabne malee deebifnee ogeessa fayyaa tajaajiluuf miti kan nu dhaabne. Kanaafiyyuu hawaasi keenya waan kan beekee yeroo nu waamichi waamichi isaanii goonu otoo waamicha kabajanii dhufanii tajaajila kennallee itti fayyadamanii gaariidha waan jedhu kanuma dhaamsa dabarsuu fedha. Biyyattillee akkasuma doktoroota biyya keessa jiran narsoota waliin ogeessota fayyaa waliin qindoomina qabaannee biyya keessatti gaafa waa hojjannu yuunivarsiitii hospitaala waliin taanee Haramaa yuunivarsiitii Arsii yuunivarsiitii Madwalaab yuunivarsiitii Jimmaa yuunivarsiitii yuunivarsiitoota kan mara waliin muuxannoo fayyaa tajaajila fayyaa keessatti qabnu biyya alatti muuxannoo qabnu isaa wal jijjiirachuudhaaf hojjechaa jirra. Kanas egaa namni beekee ogeessoti fayyaa biyya keessa jiran akka gaarii gurmaa'anii nu waliidhaan hariiroo qaban cimsanii uummata keenya kan biyya jirullee haa tajaajilu waan jedhu dhaamsa dabarsuu fedha. Waa'ee egaa COVID kan ilaalchisee keessattuyyuu nuti warra talaallii kana COVID irratti kennaa jiru keessa dhaabbati kenna warra miidiyaa akkasumas hubannoo saba keenyaaf kennuuf warra hojjetan kan akka OROMIA11 miidiyaan adda addaa dadammaqiinsa rakkoo fayyaa irratti nu hawaasa keenya goonuuf waan nu waliin hojjetaniif hedduu galatoomfannaa. Nu egaa kaayoon keenya guddaan barnoota kennu hawaasa keenya dadammaqsu tajaajila akka inni itti fayyadamu kakkaasudha. Tajaajilli sun ammoo bakka inni jiraatutti itti deemne bakka itti dhiyaatutti isaaniif kennuun kaayoo kenna. Egaa waa'ee COVID irratti akkuma kanaan dura hojjechaa turre fuuldurallee akkasuma cimsinee itti kan fufnu ta'a. Kanas egaa hawaasi keenya akka quba qabaatu miseensi keenyas akka beeku kanuma dhaamsa dabarfanna.
Hayyee akkam jirtan nagaa maqaan kiyya Abdurrahman Ibrahimi har'a IOHPA yookaan waldaan ogeessota fayyaa Oromiyaa kan idil addunyaa bakka Minneapolisitti walgahii isaanii ka chaaptara Minnesota fi ka Mid-Year Conference godhachaa jirra. Har'a sa'aatii 9 irraa jalqabne haga sa'aatii takkaatti deema. IOHPA'n gabaabumatti wanti nu ammatti yeroo ammaa kanatti irratti dalagaa jirru guguddoon sagantaan mootummaa wajjin hojjennu lamaan keessa tokko CCC jedhama COVID-19 Community Coordinator sun jechuun maalidha waa'ee dhibee COVID ilaalchisee barumsa uummataaf kennu risoorsii jira uummataaf dhiheessu kaan ammoo teestii COVID kamanatti namni ittiin laallamu hiruu akkasii tokko suni kalambeessitu ammoo Community COVID Vaccine Provider jechuun talaallii COVID yeroo ammaa kanatti ka kennaa jirru dhaabbata jiran keessa kan mootummaa wajjin yookaan Minnesota Department of Health wajjin dalagaa jiru keessaa nu takka. Amma dhiyoo kanatti ji'a Oktoobar irraa jalqabee haga ji'a Maarchitti haga nama 950 talaallii kennee jirra. As Minneapolis qofaa miti Mankato, Lesser lafa fagoolee deemnee kennaa jirra. Garuu wanni guddaan nu barbaannu uummatii keenya akka nu barbaannu serviisii yookaan ammoo hojii IOHPA'n dalagaa jiru kanarraa itti fayyadamaa hin jiru akka uummatii keenya itti fayyadamu barbaanna. Kanaafuu ergaa kanaan boodatti ammoo nulleen uummata reach outii aga dandeenyuun hin yaalla. Sagantaan kun uummata keenyaa fi kan irra dalagaa jirru uummati keenya osoo irraa fayyadame hedduu nutti tola. Irra caala saba biraa yookiin ammoo uummata community bakka biraatti service IOHPA fayyadamaa jirani. Sun ammoo hanqinni gara keenyallee hin jira. I think haga uummata baasnee uummata barsiisnee uummata waan nu hojjennu kam mul'isaa hin jirru. Ammaan booda ammoo sun irra dalanna. Kanaan duraatti ammoo duranaaf sagantaan biraa jiru maalidha? Ka CCC jennu kun duranaaf amata lamaaf giraantii arganne ammas amata lama biraatiif 2024 Juuniitii haga 2026 Juunii itti fufa. Amma immoo kan itti fufuun sagantaa isaanii bal'isuudhaan jechuun sagantaa bal'isnu maaliidhaan bakka cheerchii fa'aa masjiida fa'aatti deemnee uummata keenya ka dhibee high blood pressure qaban blood pressure isaanii screen godhuudhaan ni laalla. Namni hedduun kan beeku kilinika hin deemanii garuu guyyaa akkasii yoo deemnee dhiigi isaanii laalle dhiigi isaanii ka guddate akka isaan dooktarii deemanii laalan tolchuu hin dandeenya. Duratti dhibee high blood pressure qabaachuu beekuun faayidaan isaa stroke irraa nama hambisa, heart attack irraatii nama hambisa. Kanaafuu sun tolchuuf ammoo uummata keenya screen godhuu qabna. Amma bal'inaadhaan Juulaa irraa jalqabne sagantaa sun itti seennaa akka pilot projectitti cheerchii Ebenezer wajjin wal haasa'aa jirra. Sagantaan guddaan nu qabnu tokko suniin alaatti ammoo cheerchii sun callaa irratti hin dhaabatu bakka biraalletti babal'isaa deemna. Yoo ka danda'amu taate dhibee amma fakkeenyaaf sukkaara yookaan daabiitisii irratti illee screening A1 illee godhuuf yaalaa jirra. Itti yaadaa jirra. Ka biraa ammoo waa'ee dhibee kolesteroolii yookaan lipids panel sunillee ilaaluudhaaf irratti dalagaa jirra. So serviisii akkasii IOHPAn kennuudhaaf deema. Kanaafuu serviisa kana uummati keenya akka itti fayyadamu barbaanna. Uummatni keenya kan as jiru akka walumaa galaatti East African communities kan as jiran Oromoo ta'ee Soomaalii ta'ee sabni biraas sagantaa kanarraa yoo sila itti fayyadame serviisi akkasii hedduu uummata keenya fiduu dandeenya. Kanaafuu kootta itti fayyadamaa jenna.
Akkam jirtu nagaa maqaan kiyya Dr. Abdulqaadir Ajooleyyii Gadaa jedhama. As Minnesota irraa ogeessa fayyaa internistiiti. Guyyaa hadhaa walgahii IOHPA International Oromoo Physician or Health Professionals Association irratti hirmaachuudhaan dhufe. Dhimmis walgahii waggaa jidduu Minnesota chapter tiima ogeeyyii fayyaa Minnesota irra jiran irratti xiyyeeffata. Kaayoon isaa inni guddaan karoora waggaa kanaa irra deebiidhaan review godhu dhimma gurguddoo fayyaa uummata Oromoo biyya keessaa akkasuma biyya keenya Itoophiyaa keessa jiraniif irra mari'achuu dhimmoonni gurguddaan yeroo kana dhimma COVID irraa wanta hanga ammaa dalagame review godhu dhibeewwan gurguddoo uummata keenya yeroo kanatti as biyya kanas akkasuma biyya keenya miidhuu jiran dhibeewwan daddarboo ta'an measles irraa malaariyaa irraa akkasumas hanqina ogeeyyii meeshaa qarqaarsa hospitaalotaa fi health center biyya keenyatti akka raabsamaaroo quba qabna. Kanarraa maaltu dalagameera hanga ammaa kan jedhu ufafuu maal dalaguu qabna bifa kamiin meeshaa kana raabsina uummanni bifa kamiin nu bira dhaabatu qaba ka jedhu riippoortii dhiyeessuuf deemna. Inni dhumaa ogeeyyii fayyaa biyya keenya irraa godaananii dhufanii asitti biyya kana keessatti ogummaa isaaniitti fufuuf qarqaarsa maaltu jiraa fi akkasuma wal qunnamtii networking fi information gaa uummata kana kennu walgahii kanarraa kana eenna kan galatooma.
To acknowledge the presence among us. We have three speakers for today. The first speaker is going to be Dr. Stepanov. Her slide is the one that you guys had seen earlier. She's here. She's with the University of Minnesota. She's a researcher, and also I have a PhD candidate here who is her research associate here with us. So they will be speaking, and this is a brand new partnership between IOHPA and the research that they are planning to conduct with the help of our organization and our members. And then we have Dr. Pogmiller. She is an internal medicine hospitalist, and also she's one of the lead staff on the University of Minnesota International Medical Graduates Preparation program to help them join residency programs. We also will have another speaker, Dr. Adam Roble. He is with the MDH. He is the administrator of that program. It's called Bridge. So with the University of Minnesota and the MDH, I think that program, I don't believe any of our IMGs had ever used that program to the extent I or my organization wished, and we hope to change that trend. So I think I reached out to as many IMGs as we can, and we, some of them have already joined residencies. And that said, I would like to welcome to the podium Dr. Sapanov, and then she can speak to her topic.
What we are trying to achieve through the Institute is to build research partnerships to inform cancer prevention globally. And we do it by building, not building actually, but enhancing research capacity for cancer prevention, also focusing on innovation. Because there are so many types of research projects that have been done in parts of the world where there are really amazing access to research resources, very expensive research that takes a long time to implement and generate very important evidence to support cancer prevention. But there are places in the world where such research could be very important, valuable, to support local cancer prevention interventions, but there are not as many resources. So what we are supporting is innovation of tools, new ways of conducting research to generate data that can be actually used to inform changes in policies and practices in different countries. And important goal is to make sure that we can translate what we find, what we learn, to not just report it at scientific conferences where we talk among ourselves, we talk to specialists who understand what the data means. What we want to achieve is to actually translate it into more understandable and actionable context, so it is understood by the populations, by healthcare practitioners, as well as regulators who have power to implement cancer control policies and reduce the toll of cancer. So our expertise, I'm a chemist actually. I started as a chemist, and then I thought it wasn't fun to play with test tubes in the lab for just, its own sake. And I was looking for, ways to apply my expertise in chemistry to have some kind of real life impact. And public health was that, area that excited me. Where I could see that by actually generating chemistry data, we can inform what people are exposed to, how these chemicals interact with DNA and proteins and cause disease, but also have impact on policies and practices. So we use this background within the Institute, these analytical biochemistry tools to achieve our goals. We have really strong methodology expertise in how to conduct clinical trials that are non-therapeutic, just trials assessing exposures and biological effects in people who are exposed to environmental carcinogens, cancer-causing chemicals, and then look at how they affect DNA, employing innovative methods such as the oral microbiome to better understand exposures and biological effects, and then use that information to communicate back to community as well as regulators. So the primary focus within the Institute is on tobacco and air pollution. And these are key priority areas that we are developing, but we are open to conversations and expanding, using our expertise to address other challenges in public health in general, but also priorities of the communities that we are working with. So why tobacco? Why do we care about tobacco? Maybe in the United States, there is a reduction in the overall prevalence of smoking, for example. But tobacco does not go anywhere. Unfortunately, tobacco industry wants to stay and have business going, to still have users using the products and buying them. It's multi-billion-dollar industry. So what they do, they go and explore and exploit markets in other countries. And not surprisingly, the majority of burden of tobacco use and the related deaths and disease actually is borne by low and middle income countries at this point. We lost 100 million people in the last century globally to tobacco use. And if we don't do more than what we do now, if we are not understanding better how to prevent tobacco use, how to empower people to actually think about tobacco use as the major cause of disease and deaths, we will lose 1 billion people to tobacco in this century. So there is still a lot of work that needs to be done to focus on priority populations that are using tobacco and suffer from its use. And often it happens that it's the same people who are already subjected to some inequities who are more likely to use tobacco product. And it's not a choice. Again, sometimes it's a targeted advertisement. It's the manufacturers who want to sell their products. They devise very sophisticated ways to get people interested in buying these products and use them and become addicted. There is a diversity of tobacco products out there. This is another reason. Even here in the US, we have reduction in smoking prevalence, but there is an increase in use of other alternative tobacco products. And some health effects sometimes are more or less defined, and in some cases we still don't know what to expect. So we are trying to be proactive and better understand what does it mean when a person who smokes switches to a different product, or people who never used anything else, they start using some of these novel products like electronic cigarettes, electronic hookah, or heated tobacco products. One issue that we are particularly concerned is secondhand exposures, because it's often children or people who don't always have control over what they're exposed to would be around adults who are using certain tobacco products, and adults may not be aware that they actually expose children to really important high levels of important chemical toxicants and carcinogens. So this chart actually shows that when we use biomarkers, we look in the urine at chemicals that derive specifically from tobacco. And we see, okay, for each dose of nicotine, which is addictive chemical in tobacco, how much of cancer-causing chemicals is there in the body of a person? So if you look at people who actually smoke actively, the dose of cancer-causing chemicals per unit of nicotine is less than in people who are exposed to secondhand smoke. So, and that is actually higher in children compared to adults. It could be because children metabolize chemicals slower. It could be other reasons, because usually people are exposed to secondhand smoke. It is not filtered by the filter that is present on the cigarette. So that balance, if you just think, oh, it's just one cigarette, but someone around the person who smokes or uses different tobacco product could be actually much more vulnerable than we can predict based on these biomarker outcomes. Now, another reason why we are focused on tobacco research within the Institute is because University of Minnesota historically has a really, really strong background in tobacco research. We have, transdisciplinary coverage of different types of research across the whole continuum, from chemical analysis of tobacco products to understand mechanisms, how these chemicals damage DNA and proteins in human body, to developing biomarkers that can be used to better characterize exposures in people, in epidemiological studies or observational studies, all the way to mechanisms of addiction and cessation interventions and informing policies. So we really are the destination if we want to generate data, but also train people in this type of research. We also have state-of-the-art translational tobacco research capacity. So here at the University of Minnesota, in the Cancer Center, we have laboratories that can do chemical analysis of products, so we can smoke or vape, different tobacco products and generate smoke, and then do chemical analysis and see what is inside of the products. We also have in vitro exposure systems that are really sophisticated, the state-of-the-art exposure systems to look at cells, expose them to different product types. We have animal exposure systems, and we do actually have clinical facilities with negative pressure rooms where people who use tobacco can come in and, when they use it in the clinic, we can actually do observational studies and better understand behaviors and other outcomes. And we do have developed biomarkers that we actually develop ourselves and then validate, and then studies elsewhere use these biomarkers to better understand exposures on the population level. So we have this expertise, we have passion for tobacco research, we have tools, and we are really, really invested into sharing and growing this expertise. So we consistently open our doors in the lab to do training workshops. Just recently in December, we had people from all over the world coming to Minnesota for a plenary session that was organized by the World Health Organization. And as part of this event, we hosted this event, and we also organized a training workshop. So we had people from different laboratories around the world come to our labs and learn how to do certain procedures. So we will be organizing these events on a yearly basis. We also open our doors to internships. So anyone, we encourage even from high school to college undergraduates to anyone who is interested to get research experience in the lab in these type of procedures is welcome to come. We are part of many cancer center organized training programs. So we just pair someone from our lab with experience with the trainee and let them work on a project and generate data and understand what to do with the data. We are hoping that this will kind of excite new generation in conducting this type of research. And of course, graduate students. So we have graduate students and postdoctoral trainees who work on relevant topics in tobacco research. And at this point, I will pass microphone to Itoro, who is actually a great example of someone coming into the Institute and bringing her own passion and ideas. So all the research that we have done over many, many years, we looked at a variety of tobacco products except for hookah. So hookah and water pipe use is an important public health issue, but it wasn't part of our research program until Itoro came with her passion, and this is what we, that was the reason why we reached out to invite with this invitation to collaborate. So Itoro, to my
Good morning, everyone. It is a pleasure to be here with all of you and to also talk about my research interest, which is centered on hookah use and the risk of exposure to secondhand smoke among non-users. There is a high prevalence of hookah use globally. It's increasing prevalence globally. In my home country, even here in the US, but it is more prevalent in the Middle East, Northern Africa, and Eastern Africa. And the increasing prevalence is somehow tied to the misperception about the safety of hookah compared to cigarettes, because it is assumed that the cancer-causing agents and the toxicants in hookah is purified through the water before consumption, which is actually not the case, because there are studies that have reported, particularly biomarker studies, that have reported exposure to cancer-causing agents such as polycyclic aromatic hydrocarbons, aldehydes, tobacco-specific nitrosamines, and even toxicants such as nicotine, which is the addictive chemical in hookah tobacco, as well as lead and metals. The American Heart Association actually reported that you have more of these toxicants from hookah exposure if you compare to cigarettes, and that could be because of the extended use. Each session of hookah takes a longer time, and due to other topographies. So we are concerned about exposures among non-smokers, particularly among children, because children have immature immunity, and they also tend to breathe faster, which predisposes them to taking up more of these chemicals and toxicants compared to their body weight. And there is a lack of data on hookah studies. We have quite a lot of studies on cigarette use, but there is insufficient data on hookah use. And we would like to understand how these exposures predispose non-smokers to adverse health outcomes. So there have also been studies in immigrant communities from where hookah use is more prevalent, like I had mentioned, Northern Africa, Asia, Eastern Africa, and the immigrant communities here in the US. We, however, have noticed that the Oromo community is kind of underrepresented in studies like this that should have mutual benefits. So we are hoping for a mutual long-term partnership with the Oromo community, where we would learn and get to understand the perception of hookah associated health risk to users and non-users within this community. And because we have worked and we work with other communities of diverse cultural backgrounds, it is important for us to identify cultural acceptable approaches of assessing these exposures in the users and non-users in this Oromo community. And in addition to that, we also are looking forward to a partnership with professionals like you and members of the community in developing culturally relevant ways of disseminating the findings of our studies by creating awareness and probably developing better practices in the use of hookah. And I am excited about this. I have looked forward to sharing this experience and talking with you and working with every one of you. And we look forward to a long-term partnership that would yield mutual benefits. Thank you.
Thank you, and good morning, everyone. And I know many of your IMGs. We already work together at the Axis Medical Center, and happy to see you again here. And welcome to other guests here. My name is walakkeessa. I work with MDH since last year. I manage the international medical graduate programs and medical residency programs. So I work with the Office of Rural Health and Primary Care. So the purpose of our IMG programs are stated by our legislation, Minnesota Statute Circular 144/1911. This purpose is to address barriers to practice and facilitate pathway to assist immigrant international medical graduates to integrate into Minnesota healthcare delivery system with the goal of increasing access to primary care in a rural and underserved area. That's the primary purpose of our IMG programs. We have 3 different programs at MDH right now, and our programs are implemented by our partners. We're not dealing directly with IMGs, but it's through our partners. So one program is the Career Guidance and Support Grant Program. This is a grant to support IMGs to pay their exam fees, their books, their training, whatever expenses they have during their preparation to get into residency. So right now we have this grant implemented by the International Institute of Minnesota. That's our partner right now, and it's a grant for IMGs especially. So if you guys IMG, you are new to the States and you are in the process of getting into residency and you would like to get supported, you need help paying fees, so you can contact the International Institute of Minnesota. They have our grant there. So our second grant, it's the Clinical Preparation Grant Program. It's also called Bridge. It's a 9-month clinical preparation to residency. And right now it's been implemented by University of Minnesota Internal Medicine Department. The Bridge program right now it's open. You have to apply through the website. You will see you have to register first. And when you are registering, some IMGs email me saying that they're getting through another web page. That's fine. It's a web page common to all grant, like a loan, forgiveness, J1 waiver, all that. You just need to register first, and then you will get through the Bridge page, and you have to apply online. So right now it's open, and the deadline for that program is May 20. So you have to apply before May 20th. So it's a 9-month. You have to go through interviews with the University of Minnesota. Then you have to go to a clinical testing with the OCs. It's at the University of Minnesota also. And then they have to propose who are the IMGs who are gonna start the programs with them. So this year we have more spots. We have more funds for this grant. Usually it used to be 4 positions. This year we're going to have up to 7 positions. So if you are eligible, you can apply it. There are requirements. And the eligibility are you have to be a Minnesota resident at the time of the application, at least 2 years. If you haven't met that 2 years residency here in Minnesota, by the time of application, you have to wait into next year. And you have also to be ACFMG certified. You have to pass step 1 and step 2. I think that's the requirements. And you have to be ready to start the programs. And you have to also to have a statute of IMG. You have to be born outside the US. We're not finding US citizens who are born here. You have to be an immigrant IMG, someone who is been doctor abroad or immigrated to the US. And that's many of us are here. So that's the bridge program. It's open right now. The third program we're having at MDH is the primary care residency. That program is through our partners. We provide about 10 positions each year. So this year we already provided the 10 positions. It went to HCMC. They got 2 positions in internal medicine. I think they already matched 2 IMGs through the matching process. And the rest went to the University of Minnesota, to the surgery residency, psychiatry, and pediatric. So those residency programs are for IMGs. We have also a different program called Grand Expansion. It's not for IMG specifically, but it's for all residents who like to practice in a rural area and underserved area. The other requirement for those programs are once you are graduated from either the bridge or from the residency program, you have to practice in a rural area or underserved area for 5 years. And you have also to pay back either 10% of your salary or 15,000 per year, whatever is less. I think if you have a question, I can answer. If you have a specific question, I can answer it. Right now we have, it's not a program, but we have a legislation that's ongoing. It's been proposed by a senator who is a doctor at the UFM. Her name is Dr. Mann. And we help her to drive this legislation. It's to integrate IMGs in the workforce in Minnesota. We know that the main barrier for IMGs to get into practice in the US is the residency. Even they have passed all the exams, but it's very difficult for IMGs to get into residency. The spots are so limited, and it's very competitive. So while we have a shortage of physicians in a rural and underserved area, we propose if we can put IMGs in this area, they can work for 2 years under the supervision of a licensed physician. And this legislation about providing a temporary license for IMGs who already passed the exams, who are ACFMG certified, and also who have practiced 5 years, at least 5 years for the last 10 years abroad, so have experience as a physician. If they can work in a rural or underserved area while they are waiting to get into residency. And for the first 2 years, they have to work under the supervision of a licensed physician. So they will have a limited practice, but they will have experience. And after 2 years, they can get the full license to practice. The only ink is they're not going to be board certified because they haven't been through the residency, but they are licensed to practice. So the other challenge will be also we're going to work up with the insurances, how they're going to accept an IMG working without being board certified. But I think other states also implemented the same program and they were so successful. And I think it's possible. So right now, this legislation is ongoing. I think you can check online. It already passed the Senate committee. It passed also the government committee. The government committee was the tough committee because they have the medical board with them, and the medical board accepted this legislation. So now we are waiting for the vote with the House and the Senate on the floor. One other thing, we have done a smart survey among IMGs in Minnesota to find out who are those IMG, how many are there, in order to refine our legislation at MDH. And the first results we got are that we have about a little bit less than 200 IMGs currently living in Minnesota. And most of them, they were primary care in their home country. And most of them also arrived within the last 5 years, but there are many others who've been living for so long. And they're mostly concentrated in the metropolitan area. They are originated from 26 countries. The majority of them are Somali ethnic, but they are graduated from 34 different medical schools. The main challenge, they are saying it's difficult to get into residency. That's the main challenge for IMGs. So this smart survey really guides us how we're gonna deal with IMGs and how we can expand our program at MDH. So we're still thinking about broadening our programs. A couple of months ago, we have our first advisory group meeting, and we invited so many IMGs, and we learn a lot from this advisory group. And we hope in next year we're going to propose a new legislation to support IMGs and to not let them just work other jobs that are not medical professions, and to support them to get directly into medical field. I think that's all I have. I can take a couple of questions if you like, and if you guys would like to reach me, you can reach me at those emails or that phone, work phone number. Thank you.
I'm Hope Miller. I'm an internal medicine and pediatrics hospitalist, so I take care of adults and kids, but no OB. That kind of scares me, and I only work in the hospital. So the Bridge program, you guys already heard about it a little bit. We initially were funded in 2016, so we've had quite a few classes come through already. Most years have had about 4 graduates. In total, we've had, I think, 20 people graduate the Bridge program. We've had about 18 people get into residency. So it's not a guarantee that you get into residency, but the goal is to give you hands-on experience, because as an IMG, as someone trying to get into residency, it's easier to get an observership, although that's getting harder now because often you have to pay for them and you have to network to get observerships. But the real important thing for you to learn about the system and to show residency so that they say, okay, you're familiar with the system, is to actually get hands-on practice. So that's kind of the background, is to train IMGs who have lived in Minnesota, as you were saying. You guys have to have lived in Minnesota for 2 years, because the idea is that it's funded by the state of Minnesota to help with the physician shortage areas. And so that's why that goal is there for 2 years. There are other states that have tried to implement a similar program, but it takes a lot of different things behind the scenes that we've worked out since 2016. And we have tried to help Colorado and a couple of other states, but it's pretty unique, unfortunately, right now. And so Minnesota is one of the only states that actually has a program like the Bridge program. And then there are different efforts to try to get in without residency, that, being licensed and things that you guys were just hearing about. There were a couple other things about the Bridge program. You do have to pass your steps within 3 attempts, And sometimes we've heard people take one attempt of a step exam for practice. Maybe they're working on language, trying to figure out the computer situation, things like that. Maybe they lost power in the middle of one of their step exams, right? Sometimes that happens. Somebody actually, one of our people went into labor in the middle of an exam, right? Like stuff happens, but it doesn't really make any difference. In order to get a license in the state of Minnesota, you have to pass within 3 attempts, which is why we have that as our rule. Residency programs we've talked to so many program directors to see, hey, what are the barriers? What do you want us to prove that, these physicians can do? And one of them is do well on tests, because they need to have you guys pass the board certification so that they maintain accreditation as a residency program. So they are very concerned about test scores. And so there are so many IMGs who apply to residency who are weeded out right away. They're filtered out because their test scores, it's way more competitive. They expect higher test scores because one program may have 6,000 applications from IMGs. And so they say, well, we can't look at all of these, so what are we gonna do? And some things they look at, you guys are probably familiar with. One is how many years since residency, and another is test scores, right? So there are these things. And so what we try to do in our program is show residency programs, look, we've gone hands-on experience with people, so we know in the hospital and in clinic that it's possible for them to operate with Epic, the computer system, and then that kind of goes a long way to show that residency will be successful as well. So then they're not as afraid to accept people like that into residency. There's one other requirement that I don't know, I think it would be in a particular situation, which probably is pretty unique, but you cannot have entered the United States on a J1 or similar non-immigrant visa after being accepted to a residency or fellowship program. So apparently that probably makes a lot more sense to you if you did come in on a J1 visa, but that's the only other criteria. Other than that, it's pretty much everything that you've already heard about. I can tell you more about the Bridge program if you guys want to know or spread the word, or I can answer questions.
Of what IOHPA accomplished from 2023 to 2024 in Minnesota only. Our mission, as you know, is to address healthcare access and needs, to serve East African communities, not only Oromos, but all East African communities in Minnesota. Currently, we have 2 programs that we got grant from MDH. The first one is COVID-19 Community Coordinator, or CCC, and then the other one is COVID Community Vaccine Provider. As Dr. Brian mentioned, we were like one of the 6 providers, COVID vaccine providers in the state who have have contract with MDH, Minnesota Department of Health. This is when we got the first grant for 2022 to 2024. So the main objectives or goals of the CCC is really to inform our community about the current status of COVID-19. As you know, no one wants to hear about COVID anymore, but COVID still exists. People are still hospitalized and dying from COVID, but we still keep talking about COVID, even though no one wants to hear or listen. And we have been distributing free COVID testing, like home COVID testing. We got all those resources from MDH. And then we inform our community where they can go and get the vaccines and what vaccines are available at the moment. And we encourage our community to be vaccinated. This is our team, myself, Dr. Mohammed, Dr. Kimfe, and Girma Hassan are part of the CCC program. And then the COVID Community Vaccine Provider. Initially, the program was from June 2022 to June 2023, so extended to until June of 2024, and we are talking with MDH to extend that beyond June of this year, possibly for another year, but we didn't really get any final approval yet. But on the CCC, I don't know if I mentioned, but we just received an email about a week ago that they extended our program for 2 more years. So we'll be working on the CCC actually in a broader way, like a comprehensive recovery programs until June 2026. Okay. And our partners, we have been working with Minnesota Department of Health, Oromo Community of Minnesota, IANA, or Islamic Association of North America, Ebenezer, our Redeemer Church, Tawfiq Islamic Center. We have been there at least once or twice. Wilshire International, Korean Service Center, Access Family Clinic. And this just is some of the events that we had. This is with IANA, and this is with Wilshire in Minneapolis. I think I remember on this day we vaccinated maybe 110 people within like 4 hours. This is Wilshire in Mankato. We have been there several times. This is actually from last year, July, at the Riverside Park with the Oromo Community of Minnesota picnic, July 4th. And this is with the Korean Service Center. And so far, starting from, I didn't really put together from November of 2021 until now, but I put only what we have done since November of last year, 2023 to March 2024. As you see, in November, we administered 91 doses of COVID vaccine, which is the new one. December, 282. January, 149. And February, look, 406. This is homeless people who live in the shelter. We traveled to Mankato, Le Center, Le Sur, and other places. And as you see, from 406 doses to 22. Do you know why? We have been providing incentive prior to that. From November to February, we have been giving $100 per dose. Now the incentive is stopped February, so in March, no one took the vaccine. So incentive really works. But some people still, they question you when you give them $100 and get the vaccine. So hopefully the incentive will come back and we will administer more vaccines. And the other thing that I didn't put it up here, but within these 5 months, we gave about 56 doses, which is like a first timer. They never received COVID vaccine before. So this is the first time, about 56 people. So we are planning to do more services starting from July. As I said, the CCC is going to continue until for another 2 years. We are trying to do the pilot project. As you all know, East African communities, we don't go to primary care clinic. We don't check our blood pressure, A1C, or lipids panel. So we are partnering with MDH. We are at least going to start at Ebenezer, Oromo Evangelical Church, and then we're going to expand that program to other locations. So we are planning to do at least 2 events every month, checking their blood pressure, and if there is any issue, we can connect our community with the primary care clinics. And then A1C as well, and then lipids panel. MDH was actually talking about the pre-diabetes. Out of 4 people, only 1 person knows their A1C status. So other 3, they don't really know if they are pre-diabetes or diabetes. So we try to access, provide services for our community to detect if they have any high blood pressure, any coronary artery disease related issues. And then we are planning to work on long COVID. As you all know, COVID came with a lot of problems. Long COVID is having symptoms for more than 4 weeks after you test positive for COVID. And then long COVID is actually one of the, considered as a disability now. American Disability Association consider long COVID as a disability. But our people, not only our people, majority of the people, they don't really know what is going on. They just say, I'm really tired all the time. I'm weak. I don't have any energy. And if you look deep, they might have been experiencing long COVID. So we try to educate our people and then connect them with the resources that is really available for them. Even they can apply for SSI if they have long COVID. So we are planning to work on that and planning to work on mental health issues in our community. A lot of suicide reported in East African communities, a lot of drug abuse disorder, drug use disorder in our communities. And in the coming 2 years, we are planning to focus on the mental health and drug use disorders and other stuff. And we are planning to hire at least, for sure, 1 full-time, if not 2, but we apply to different grants. If we got the other ones too, we might go to even 2 or 3 full-times and more part-time to address these all issues. This is all I have, and if you have any question, I'm happy to answer.
We accomplished this all without having a single hired staff, right? All the others that you have seen, including Abdurrahman, whenever they have like an event, he would assemble his team, they will go. And they get paid per the event that they organize. So it's not, we have never had any hired staff, although we have been partnering with the MDH for the last 3 years. We never actually even asked for funding to cover our operational costs because we are volunteers and we have been working from home. I think that needs to change if we need to engage and provide a more meaningful services to the community, especially helping our community access healthcare services. There are a lot of organizations, including the Oromo community of Minnesota and the Oromo faith-based organizations. We have been working more with others that are very much available and willing to work with us. The Oromo Evangelical Church, the Ebenezer, and our Redeemer. And it's up to the other to question if their faith-based organizations are willing to help them access or even work with IOHPA. This is a criticism of the Oromo community of Minnesota and the Oromo faith-based organizations that have not used. We are here to serve this community, right? We do not benefit nothing. And it is, someone was asking me like, how does the Oromo community help you in Minnesota? I said, we don't need help. We are here to provide services. All we want is for them to know that we are here to serve. We are here to connect them to resources. We are here not for our members. Our members are volunteers who want to help the Oromo community in Minnesota and everywhere. I call upon, especially the Oromo community of Minnesota, if they have a board, leadership, to utilize our members and our resources to the maximum they can. We are here to serve. We are not here to provide services to our members. Our members are healthcare professionals. So that message has to go to these faith-based community organizations that have been organized as nonprofit entities.
Hello, everybody. Thank you for coming and taking time out of your busy schedule. And this half or mid-year meeting is a kind of Dr. Ibrahim's impromptu event that he put together, at least, instead of waiting the whole year to meet once and assess what we've been doing for the whole or the past years. Mid-year, we assess our 6-month journey and maybe adjust the gear so that we can swiftly catch up with what we've been missing from the previous half year. And it's, I hope I will take it as a tradition we're going to keep. And the other good news is what Dr. Abdurrahman have been doing. He's been an engine that really drives the wheels of IOHPA. We'll keep it rolling, hopefully, with all your support and help. And the rest is, you know, if we want to go far, we have to do it together. And my name is Jamal. I hope Dr. Ibrahim will lead me on a very fertile ground so that we can plant a seed for tomorrow that we can all share the fruit of. Thank you.
Akka moltan dhaggeeffattoota keenyaa ani maqaan kiyya Gabii Kurkuraa jedhama. Ogeessa fayyaa naannoo fayyaa ispeeshaalistii naannoo fayyaati biiroo fayyaa Minneapolis hojjedha. Asuma irratti ammoo dhaamsa tokko isin dabarsuu barbaada. Yeroo ammaa kana keessatti rakkoon fayyaa rakkoon nageenya fayyaatiin wal qabate baay'ee tokkotu jira. Akkuma beektan miidiyaan garaagaraatiin IOHPA'n keenya yookaan dhaabni keenya kun yeroo baay'een barsiisaa ture. Haa ta'u ammoo ammallee wanni amma adeemaa jirullee hin jira. Irra guddaa yeroo garaagaraatiin sagantaa garaagaraatiin isinitti deebi'uu hin dandeenya. Haa ta'u amma irra guddaa wanni ani isinii dabarsuu barbaadu biiroon Minnesota keessatti bara itti aanu kanatti wanna qoricha yookaan marijuana jedhamu gabaa irra oolchaniiti namni akkamitti akka itti fayyadamuu danda'u yookaan ammoo daldalaan hayyama daldalaallee kennuuf hunda adeemaa jiraniif hawaasni keenya wanna kana sirriitti dhaga'ee uduraafillee eeggannoo godhee barumsallee akka hordofu isin yaadachiisuu barbaada. Ispeeshaalii warra dargaggoo lafaa dhufu kana warra isaan irratti dhiibbaa guddaa fida jedhee yaada akka nama tokkootitti. Kanaafuu maatiin ijoollee keessan hordoftanii wanna kana ammoo irraa akkamitti akka of eeguu danda'an ufduraa fi karoora garagaraatti walitti deebinee hawaasa keenya barsiisuuf karoora qabna. Haa ta'u seerrillee ammoo amma irratti hojjetamaa jira. Rule making jedhanii haga state irratti hojjetamaa jira. Achiin booda gadi bu'ee local government office yookaan naannoo magaalotatti countytti yeroo kennamutti jira. Yeroo sanii ammoo bal'inaa walitti deebinee isin barsiisuu hin dandeenya. Agarsiif wanna kana hordoftanii akka ijoollee keessan kanarraa baraartan isin yaadachiisuu barbaada. Galatooma.
Harka fuunee akkam jirtu maqaan kiyya Dr. Kinfee Hayilee Yesuusiiti. IOHPA waliin hojjedha. Oromoo International Health Professional Association chapter Minnesotaatti coordinator vaccinaati. Wanni gabaabduun ani saniin jechuu fi OROMIA11 irra dhufee fi dhimma COVID wal dubbachuu fi COVIDin kun amma tureera. Namni hedduun talaallis fudhateera. Garuu haa ta'uuti malee amala vaayirasii kanarraa kakahee vaayirasichi amma of jijjiireetiin waan dhufuu fi gartee beekumsi waa'ee COVIDii ka addunyaan qabdu guddataa dabalaa waan deemuu fi talaalli haarawaa yeroon baasanii kanaafuu amma talaalliin haaraan jiru COVID-19 2023-24 ka jedhanii jira. Sun namichi ufti nami Septemberii waggaa darbeeti as takka COVID vaccine fudhachuu qabaa jechuudha. Kabira immoo waa'ee COVID irratti wanni ani dubbachuu barbaadu long COVID waan jedhan tokko jira. Nami hedduun eegi gaaf COVIDin qabameeyyuu takka nafi kiyya akka duriitti hin deebinee nin dadhabaa yookaan immoo gartee sammuunti tun clearly yaadduu nafan na cacaacabaa ka jedhu waan gartee long COVID jedhan kan tahuu danda'a. Kan addaan baafachuu fi doktor keessan dubbisaati akkasitti addaan baafadha. Wanni kun amma akka seera Minnesotaatti akka seera biyyi kanaatti disability ta'uu deemti jechuudha. So akkasi beektanii akka namni vaaksinii fudhatan kaan immoo namni eegi COVIDin qabamtanii qaamni keessan akka durisanii deebi'uu didee doktor keessanii wal dubbadha akkasitti hubannoo gaarii argadha jedha. Galatooma ulfaadha nagaatti.
Egaan kabajamtoota daawwattoota OROMIA11 sagantaa isiniif dhiyeessaa turrerra waan hedduu barattanii jirtan jennee abdanna. Gama kennaan nagaa isinitti dhaamanna. Ammas COVID-19 ala kana waan jiruuf of eeggannoowwan barbaachisu. Inni irraanfatinaas ni jenna sagantaa hawaasaa biraatiin hanga walitti deebinuuf nagaan nuuf jiraadha.